A lot of persons are not aware. So because of ignorance, people just go into marriages without even check.
Over the years, many people have neglected the right medical steps to take before they begin relationships and the basic knowledge about health compatibility, especially genotypes and blood group, before going into marriage. This has resulted to a monumental medical crisis like sickle cell anemia in the society. These individuals end up having children who suffer from one ailment or the other with different symptoms, leading to several unrest, panic, and divorce cases, among others.
Whether you are AA, AS, or SS. And I think it is very important for someone to know his or her blood group and her genotype and that of your spouse. You will have to know your own first, at least start from your own. And a lot of persons don't even know their genotype, not to talk of their spouse's own. So I want to appeal to the general public that before you start into any relationship or before you even think of getting married, there is a need for you to check your own blood group and your genotype.
As your life progresses, you are going to meet with your soulmate, and if you are not compatible and you yoke together, and this will eventually what bring crisis in your family, and I don't think anybody as in is ready for that. So I think I've experienced people who have as in children out of as in checking the genotype, and at the end of it, as in, it was not really too good. I haven't trained the child up to university level. Before you know it, because of the crisis, you lost that child, and I don't think the parents will be happy. So I believe we can avoid it by at least knowing your genotype and your blood group, so that at least you know who you are getting married to.
We don't check our genotypes to know which is our genotype. So imagine someone who is AS, AA, or SS rather. So someone who is AS marrying AS, there's a high probability that 50-50% that the person is going to give birth to all children SS, and there's also a 50-50% that the person might not even give birth to a sickler. So that's why, as an individual, before you move into courtship or whatsoever form of relationship, it is advisable that you check your genotype.
A medical practitioner at the University of Benin Teaching Hospital (UBTH) and a professor of hematology and lecturer in the University of Benin, Professor Wogo Benedict, gave a professional counsel on this issue.
Potential couples who happen to discover that after a long period of relationship they are not compatible, I think it's still the heaviest thing. Education is the key. As long as people are being educated and oriented on the risk of having an SS child, if incompatible couples marry, it will go a long way to reduce the burden of the disease. Education is very important. And beyond education, I also think a lot of avenues will be provided for people to know early their hemoglobin genotype. If it's made compulsory to some form of schemes that either from birth, make it mandatory, either from birth or preschool screenings or pre-job screenings, create multiple avenues for people to get tested and probably make testing somewhat a little free, even though it's not so expensive as it is now. But making it free probably make more persons may be able to access it and not give any excuse for doing it. So we'll make provisions for assessing testings at different levels. It will go a long way to make people conscious of their genotype. And also too, like I said, our organizations, the media play their roles, just like they're doing. Some health talks, some campaigns on it will go a long way to help.
In the same vein, some medical experts at the University of Benin Teaching Hospital, including one Mr. Sylvester Ogeriaki, who is a personnel in the Medical Lab Science Department, also spoke extensively on the failure of most intended couples who goes into marriage without doing the needful medically.
Knowing the genes resident in your hemoglobin. For instance, there is hemoglobin genotype AA, hemoglobin genotype AS, hemoglobin genotype AC, SC, SD, AC, and so on. So there are variants or various forms of hemoglobin genotypes. But physiologically, hemoglobin AA are usually very normal. AS also normal. SS is an abnormal hemoglobin. AC abnormal hemoglobin, and all others are abnormal hemoglobin, which when they combine could result to one or two physiological abnormalities in babies. So it's usually very important for individuals to ascertain their genotype before, getting married. Very, very important. For instance, if I'm AA, of course, I'm very free to marry anybody. But if I'm AS, I should be mindful not to get married to AS, because in combination, 1 in 4, ratio 1 to 4, there's a probability of having a sickle cell SS in 1 in 4 births. So that is 1 in 4 if you do the genotypic crossing.
The risk of going into marriage without taking some medical steps to avert uncertainties in having children is the beginning of creating a ground for potential crisis and a colossal ruin in marriage. To this end, intended couples are advised to take the bull by the horn for a healthy future of their children. Ebe Igboraise, reporting for BTV News.